hygiene. Hi, Mr. Smith. My name is Maggie. I'm going to be your nurse today. I'm going to change the dressing on your wound. Can I have your name and date of birth? And can I take a look at your arm again? Great. I'm just going to move the bed out for me. How would you rate your pain on a scale of 1 to 10 today? 2? Okay. Not too bad. Now I'm putting on clean gloves. All right, Mr. Smith, I'm going to go ahead and remove the old dressing that you currently have on the wound and take a look. I'm just going to use my hands to touch around the area around your wound, and you're going to tell me just if you feel any pain or tenderness. No? Feel good? Now I'm going to go ahead and take off the old dressing. So on the AVD pad, there is a very light serous drainage. And then on the first piece of the dry gauze, there's also a light serous drainage. And on the second piece of the dry gauze, there is a light serous drainage. And then on the packing gauze, we have light bloody drainage. I would now go ahead and measure the height, width, and the depth of the wound. Right. So what I'm going to do now is I am going to begin to set up my sterile field. My hands are not sterile right now, so I'm going to have to open this away from me and be careful not to touch the side that is not blue and the 1-inch margins. Okay, this one. So the blue side is not sterile, so I can touch that. And the 1-inch margins on the other side are also not sterile. Try to avoid reaching over the sterile field as much as possible. Now I'm just going to go ahead and undo my supplies before I put on my sterile gloves, because once I put on the sterile gloves, I can't touch the outside packaging.